It is 9 a.m. when Aicha Ibrahim arrives at MAITAMA General Hospital in Abuja, Nigeria's capital. This 54-year-old mother of 6 children have benefited from family planning services for over 20 years. Today, she came to vaccinate her second grandson and bring her stepdaughter to the reproductive health service of the hospital.
Family planning is very good. It will make you to plan everything that's about your children, how you want them, and the number you want, and the age you want to give gap. Like my daughter-in-law now, she have 2 babies, so I want her to give gap so that she can plan her family very well, because she wants to go back to school.
Since 2001, the hospital tries to ensure quality of care for populations of the Federal Capital Territory and beyond. Just as Aicha and her stepdaughter, there are more than 2,500 women to take advantage every year of access to maternal and reproductive health services at MAITAMA Hospital. Services dedicated to ensure safe childbirth and avoid unwanted pregnancy in a country where more than 100 women die every day trying to give birth.
So when they come, we do counseling, opening of, that is a booking of claims. We book our claims, we do general physical and speculum examination, then we offer them the method of their choice that is suitable for them medically. And apart from them, we counsel them on other things, on STIs. And we offer youth-friendly services as well.
The main goal that we have, just like the national goal, is to increase our CPR to 36% by the year 2018. And when this happens, you discover that we will drastically reduce our maternal mortality and infant mortality rates. In the FCT presently we have 25.2% CPR, and we are working, doing everything humanly possible to see that we also fall alongside the national target, which is 36% by year 2018.
With a population of over 187 million people, Nigeria is the most populous country in Africa. Despite the establishment of free contraceptive services since 2011, the fertility rate fell only 0.2% from 5.7 in 2008 to 5.5 in 2013. Nigeria's population continues to increase by 3.2% per year, a context which led Dr. Babatunde Osotimehin, Executive Director of UNFPA, the United Nations Population Fund, to return to his native country to review the actions implemented by his organization to help the government regulate its demographics.
When you look at the population of Nigeria in the context of the world, we're about 2%. But Nigeria contributes 10% of maternal mortality globally. And that means, and when you calculate it and you look at it, it implies that every day in this country, more than 100 women, something close to 120, die giving life every day. Now, totally unacceptable, because what the interventions we need to put in place to stop this are known, they are simple, they're cheap. And basically, what we need to do is to scale up, provide more resources for this, and get greater reach so that every woman everywhere in Nigeria can get the service she requires during pregnancy and labor.
Thanks to the expertise of UNFPA and DfID funding, the UK Department for International Development, the government of Nigeria has managed to make free family planning services in 7,800 of the 25,000 Nigerian health centers. But the review of the National Strategic Health Development Plan established between 2009 and 2015 revealed large gaps in medical coverage throughout the territory. In order to better understand the needs of the country, UNFPA Executive Director, accompanied by DfID Permanent Secretary, met the Nigerian Vice President, the Ministers of Health and Foreign Affairs. The approach aims at strengthening political commitment and, above all, increasing local resources for the expansion of maternal health programs, including family planning.
The UK government is really proud to be supporting UNFPA's work there, and I was very encouraged to hear from the health commissioners from the northeastern provinces, northeastern states, that the work the UNFPA and the other development partners are doing is exactly the kinds of things they need at this stage. There's a variety of other things that we will need to do as well, especially to deal with food insecurity and girls' education and so on. And DfID, working with other development partners, and UNFPA are keen to help in those areas too. But we were very encouraged, I think, by the discussion we had with the commissioners.
DfID has supported us not only in the area of system strengthening, but also improving maternal, newborn and child health in the north. They are currently supporting, I think, about 6 states in the north, and that will also contribute to our plan to contribute to really revitalize 10,000 PHCs. And DfID will contribute about 950 of the PHCs. So this is good for Nigeria. And then UNFPA has also supported us with respect to maternal, child health and adolescent health.
We have to now start being a lot more rigorous in the coordination between the government and the development partners and international organizations. You know, the big question is how effective is that cooperation and that coordination.
En investissant dans la planification familiale, on peut réduire.
While investing in family planning, we can reduce around 30% of the maternal mortality, which has a strong rate worldwide. This was a fruitful visit, a perfect convergence between the DfID and the UNFPA, but also a strong political commitment from the highest authorities of Nigeria, starting with the President of the Republic, whom we've met not long ago, also the Minister of Budget, the Minister of Health, the Minister of External Affairs, and the Minister of the Territory of the Capital. All of them have agreed to the positive and dynamic character of this partnership, their great engagement in favor of the Nigerian youth, but also their total commitment to help decrease the mortality rate here in Nigeria, because if we do not win the battle here in Nigeria, we can win it in Africa.
The humanitarian situation in the northeast of Nigeria, plagued by insurgency group Boko Haram, was also discussed during the visit of UNFPA Executive Director. During a conference and meetings behind closed doors, the manager talked about the issue with health commissioners, international partners, and members of the civil society.
It's an open secret that the maternal mortality, infant mortality, and childhood mortality are all very poor in those areas, even before the insurgency. And the insurgency has only made it worse. So what we've discussed is, like the minister used to say, to do family planning is like vaccine against maternal and newborn mortality and deaths. So we were brainstorming on how to move forward. And in my contribution, I did tell them that we were in the same situation with polio some years back. And the approach was such that we approached where the issues were. And I suggested to them that I think the approach towards our traditional and religious leaders to accept the concept of family planning will go a long way.
When it was really bad, a woman might be in labor and can't get out. So she has to deliver in the home, and she can't, not to talk about going to procure products for family planning services. She can't go for antenatal clinic. She's afraid she could be bombed. You are afraid of being in a gathering, and definitely hospital is a place of gathering. So it has really had a devastating effect on maternal child health in northern Nigeria, especially northeast.
It is in this context that the Initiative Action for Adolescents was established. This program, supported by UNFPA, trains vulnerable girls about their rights, their bodies, and their health. Located in marginalized and often rural areas, the program tries to keep girls in school and help them meet their own needs. It is this kind of program that UNFPA intends to expand in Nigeria to strengthen the health system and reduce maternal morbidity.
What we do is to ensure that these girls are enrolled in school, then they are also retained in school. We try to reduce the economic barriers, like provide them with school fees when necessary, and then give them books when necessary. And we don't just stop at that. In order to reduce the social barriers, we create a safe space for the girls. A safe space is a place where it's only girls, and then they have a mentor. These are mentors who teach the girls the skills that I'm talking about, the life skills, the literacy skills. So it is a school-based, after-school classes, so to say, where those girls come together. They have a mentor who help to build them and then make sure that they have access to this information.
Gradually, girls are learning and are trying to empower themselves. Even parents that are not willing to release their children into this program, since they're seeing how we've learned from it and how we are growing and how we are becoming neater, unlike the other girls, how we are also able to get money. That's through the business financial empowerment, but from the initiative, people are able and willing to release their words now to the initiative.
Family planning to a woman is empowerment. She takes charge of her life. She is able to plan effectively how many children she wants to have, when she wants to have them. She's also able to plan, to determine the number she can afford to have, so that she would have quality in her family. And I think that is not too much for any woman to ask. So we at UNFPA, working with government of Nigeria, would like to provide that facility everywhere, so that women can enjoy access to family planning, make choices, have the number of children they want to have, and be able to look after them effectively. And by so doing, reduce maternal mortality. Now, maternal mortality also has other aspects, which is, provision and insurance that there are skilled attendants at every clinic who can look after pregnant women. But, being able to provide family planning and the availability of skilled attendants to look after pregnant women are coterminous, because the same person will do both.
6 million Nigerians benefited from family planning in 2015 with the support from UNFPA, but the country will need basic products amounting $12 to $16 million to ensure broader coverage of health reproduction. In addition, nearly 3,500 midwives will be trained every year for the next 15 years to enable Nigeria to cover the health needs regarding the reproduction of its population by 2030.